Hi, I'm Dr. Mike Milligan. We're here at Woody Oaks Excellence in Dentistry meeting. So if you haven't been to one, please come. They're fantastic. You learn so much and you meet so many great people. And I have for you right now Dr. Uche Odiatu from Toronto, Canada, one of the keynote speakers here on fitness and longevity of your practice and things like that. Uche,
for sure.
Thanks so much for being with us.
Thank you for the invite. I always love sharing my enthusiasm and passion for this whole topic.
Okay, so Uche is a dentist. His wife is the fitness champion.
She's a Canadian fitness champion. She was a professional IFBB fitness athlete. She was a 1998 Miss Fitness Universe.
My goodness.
So she's 42 years of age, and the lady's amazing. She can walk on her hands. She can do 12 chin-ups. So I am inspired to stay in shape.
Okay, so, and you know, that's so important. I do Pilates a couple times a week. I have an elliptical and bike in my basement.
Okay.
You know, trying to stay in shape because, you know, the longevity of your career, both in dentistry and then your ability to play golf or whatever you want to do. It's so important.
For sure. And to get in shape and stay in shape makes you a better communicator with your patients. If you're talking wellness, you're talking health, you're talking hydration, you're talking mouth dehydration, you're talking posture, patients get it. And if they see a sparkle in your eyes, if they see a straight back, fresh breath, they see you not apologizing for being tired or it's 4:30 in the afternoon, your communication is so much more authentic. So a big part, I think, of learning about this wellness topic is not just about presenting better dentistry, it's about taking care of the number one vehicle, which is yourself.
Fantastic. Yeah, that sounds great. So tell us, our viewers here, some of the things you spoke about this morning in your talk here at Woody Oaks. He spoke here at Woody Oaks meeting. He's speaking at the American Academy for Oral Systemic Health meeting in September, just all over the place. And so tell us about what you talked about here today.
Well, this morning, it's one of my classic keynotes. It was 90 minutes. It's called Keep Your Edge at Any Age.
Yes.
And basically it's an hour and a half, pump up the jam. I find it hard. It's basically almost a synopsis of about three and a half days of topics that I have.
Yes.
And the whole idea is to help healthcare professionals no longer apologize for being their age. You know, if they're 29, dreading 30. If they're 39, dreading 40. If they're 49, going, well, I'll be 50 next year. If they're 59, dreading 60, 69, dreading 70. And I talk about the ability to vision yourself, how you're going to look and feel at 100. Okay. I talk about having a health span instead of a lifespan. I talk
quality, not just quantity.
Oh, for sure. Most people think, if I ask 1,000 people at an ADA conference a few years ago, who wants to live till 100? Out of 1,000 people, 7 people put up their hand. Because most people think of 100 as being just sliding into home plate.
Right.
I'm talking about plowing into home plate and having that long health span. I think Dr. Andrew Weil, this is not my topic, this is Dr. Andrew Weil talks about the same topic.
Right.
So having a huge amount of cognitive reserve. Cognitive reserve is knowing your own cell number, knowing 10, 20 different 30 numbers in your cell phone. Forget the programming part. I'm saying having it's called brain-derived neurotrophic factor. Okay. And one of the, this gentleman actually wrote a nice testimonial for us for our book, The Miracle of Health. My wife and I wrote this together.
Okay, The Miracle of Health.
The psychiatrist from Harvard, Dr. John Ratey, said that we're cheerleaders for what he's been talking about. He's got a book called Spark. And he said anyone who exercises will have more of this thing called BDNF. BDNF is the same thing that works on plants. It's almost like miracle grow for the brain.
Okay.
So if you have two dentists of equal technical ability, equal IQ, the person who's the exerciser will always outperform the other dentist.
Right.
So it's a great even playing field. Some could have gone to Harvard, some could have gone to a small state college that they think they were never good enough. But if they exercise, and a person from Harvard doesn't exercise, they will outperform the other person. So it's a great equalizer.
Yeah. Wonderful. Okay. So let's see now. You're also going to talk at the American Academy for Oral Systemic Health. Mm-hmm. Tell us a little bit about that and how what you have affects the rest of the body.
Okay. You know, and it's part of my own thing I took for myself. I've been a dentist since I was 28, but I've been an athlete since I was 13. Okay. So I'm a little bit more engendered to the athletic part. But I'm triple certified as a personal trainer through NSCA, Canfit Pro International in Canada. And on that note, every time I had patients in the chair, when you put some local anesthetic in, usually a dentist would have maybe 3 or 4 minutes to kind of talk and chat.
Right.
And over the last 10 years, I've seen patients come in with bad backs, or a canker sore, or an aphthous ulcer, or a skin blemish, or saying, oh, pardon me, I need a break in the middle of the appointment, or these are my new list of meds. And I find myself intrigued as to where all this is going. You know, how many more TMJ appliances I'm making, how many more patients are just losing hair for some reason, alopecia. And I keep saying, did you know there's things that you can do to help you with that? Or in the 3 minutes that we're waiting for anesthetic, if you don't have a personal trainer, there's a few people in this area who train people like yourself. Or have you ever thought of going to a chiropractor? Have you ever thought about getting a physical done? And then I see people get, I've never had a dentist ask me these questions before.
Sure. Okay.
And think of the average doctor. They think the average medical doctor visits 7 minutes. We have an hour for most of our treatments.
Absolutely.
We have such a huge opportunity.
And we're preventive oriented, whereas most of the physicians are therapy oriented.
Well, you think how much time in our dental offices are dedicated towards prevention. You think at a 2-dentist office, there'll be maybe 4 or 5 dental hygiene rooms.
Right.
While in a medical doctor practice, if it really was preventative oriented, they'd have juice in the waiting room, vegetables hanging from the ceiling, garlic, water. But there's nothing there except prescription medicine, nothing.
Right.
So I firmly believe that prevention is a huge investment, and it's an easy investment to make.
Absolutely.
So I want to share at this conference coming up in September, and I think I'm one of the closing speakers, but I want to leave everyone zooming out the door. They may have to leave their cars in Vegas. They'll be so motivated, they're going to be running home after.
After this little interview, I think that's going to be happening, Uche. So are there any last things you'd like to tell us, Uche, before we close here to help our dentists and motivate them in this direction?
Well, a lot of dentists in particular ask me, how do you charge this information? How do you charge home people with their wellness? But you know what? I call it value added. The value added is that the minute I'll have a patient in the chair, her husband may not come see me. And she says, doctor, I've never asked someone ask me about supplements before. Tell me the value of drinking water or the value of green tea over coffee. Do you take new patients? And I said, I thought your husband goes to another dentist. He's got to come see you. And do you see kids? And I said, oh, I love kids. I treat my own. I get 5 patients from one without advertising. You can spend $1,000 a month on your Yellow Page ad. And value added is I'm just in a conversational style, and it comes from the heart and it's authentic, especially if my stomach is flat and I'm speaking very clearly.
Absolutely, without a doubt. Now, Uche, how do we get in touch with you for more information?
If you want to go fitdentist.com, so FITDENTIST. It's not fat dentist. I used to be overweight a long time ago, so it's fitdentist.com.
Okay, it's
not fat, fitdentist.com.
Okay, good.
And I answer emails all the time. Next week I'm speaking in Toronto, the week after at the Star of the North in Minneapolis. I'll be at AGD in Nashville in June.
All good meetings.
Jamaica sometime in May, New Mexico.
And all these on your website? So
they're all on the website,
can find you?
for sure.
Okay, and see where they can go hear you?
For sure.
Uche, thank you so much
Pleasure.
for being with us.
Yeah, thank you.